The Better Health, Better Care Action Plan committed the NHS to work together with Volunteer Development Scotland to refresh the strategy on NHS volunteering and consider how best to recognise the role played by volunteers. 1 year on, we shall now reflect on the strategy and listen to the views of key people involved. So what do people think about the progress made in the first year of the refresh strategy? We spoke with 5 people who are involved with the strategy in different ways and asked for their views. Heather Tierney-Moore chaired the national group set up to provide national leadership and drive in implementing the strategy for most of the first year, before moving to another NHS post in Lancashire in December. We asked Heather for her thoughts.
Well, I think we got off to a good start. Certainly the national group was very enthusiastic and supported me very well as chair. I think we've started to get greater consistency of approach across the NHS in Scotland around volunteering. There's been some very useful policy work developed which has helped boards to be very proactive in relation to their approach to volunteering. I think the service managers who support volunteers, I know, have felt very much more supported by the work that we've been taking forward. And I think it's helped to raise the profile and the importance of volunteering. It's a very clear commitment from ministers downwards to this being something that they want the NHS to engage actively in. So I think it's made a good start. I think there's still more to do. And I think it's important that the impetus of the first year is not dissipated as we move forward, because it is just a start. But I do think it has been successful, and I've been impressed and pleased by how people have engaged with it.
Voluntary services managers are employed by NHS boards to recruit people into volunteering in the NHS. They also support volunteers, help to develop new volunteer opportunities, and play a part in developing policies on volunteering. There are currently 40 such posts in Scotland, and voluntary services managers are key players in helping to progress the strategy. We asked Agnes McKenna, a voluntary services manager in NHS Lothian, about the refresh strategy and if it had brought any benefits to her and other voluntary services managers.
I feel that the strategy has certainly raised the profile of voluntary services managers within the NHS. We have a lead member of staff who has taken over the overall responsibility for volunteering at the board level, working with BSMs to develop a volunteer policy and procedures throughout NHS Lothian. And it helps that the voluntary services managers are now working together as a team with the same paperwork, same procedures.
The strategy needs support from out with the NHS if it is to develop and achieve its full potential. Organisations out with the NHS, such as volunteer centres, have a part to play. We asked Harriet Eadie, manager of the Volunteer Centre in Edinburgh, if the strategy had been helpful locally.
The refresh strategy on the NHS has been really helpful in Edinburgh because it's actually made consistent practices and procedures run through all the organisations. The other really strong effect that it's had is encouraging closer work with the councils. So because the NHS has put a volunteering strategy in place, it's been really supportive in the joint work with the council to improve their practices and procedures. And the council is beginning to go down the road for its health and social care department of investing in volunteers, which it means that there'll be consistent practice across council departments and across NHS departments that work really closely together.
The NHS is a large and complex organisation. A big challenge for any NHS strategy is around the level of awareness it achieves amongst relevant staff. The refresh strategy needs to have a high level of awareness to enable people in the NHS to think more how volunteering might improve the health of patients and service users. We asked Tim Montgomery, Operations Manager at the Royal Edinburgh Hospital, for his view about the awareness on volunteering and the strategy.
I think there's an increase in awareness. NHS Scotland has a strategy now. We're much more professional in how we recruit volunteers, how we take them through a disclosure process, and working with volunteer centres, that helps us do that. We can learn from them. So I think at a strategic level, the NHS is pretty switched on there.
Encouraging partnership working between relevant bodies has been an important part of the first year of the Refresh strategy. One example of partnership working has brought NHS Education Scotland and Volunteer Development Scotland together to look at ways of enabling NHS staff that manage and support volunteers to access learning on good volunteer practice. We asked Helen McKinnon, Director of Nursing, Midwifery and Allied Health Professions Directorate at NHS Education Scotland, about this partnership.
What we're doing as a first starter for 10, if you like, is to really focus our attention on those people with responsibility for managing and supporting volunteers. So we're doing a survey to find out what their needs are and what the shape of the educational support should be, and then we're developing it, delivering it and evaluating it in partnership with Volunteer Development Scotland. And like all the other boards, we had Partnership in Care that the Scottish Government put out in 2003, and that at that point committed NES to supporting education on the patient-focused public involvement agenda. And if you like, this work stream around volunteers for us comes under that umbrella. We've got an advisory group, an educational advisory group that we've now established. And the idea around that advisory group is they set up an educational framework that embraces all the different strands of patient-focused public involvement education work. And the voluntary piece on that is dedicated into a subgroup. And they're looking at, as a subgroup of this training advisory group, they're looking particularly at the needs of volunteers and those that manage and develop volunteers. We've got to make sure in NES that any work that we do maps into the KSF, because that's, if you like, that's the vehicle by which education and training is mapped, appraised and delivered. So we'll be supporting Volunteer Development Scotland to make sure that anything that they do can be congruent with the knowledge and skills framework.
One of the key aims of the Refresh strategy has been to try and ensure that volunteers have a consistently positive experience whenever and wherever they volunteer in Scotland's NHS. The strategy has made use of the Investing in Volunteers nationally recognised quality standard, and government ministers have asked all NHS boards in Scotland to achieve the standard by April 2011. We asked Jackie McQueen, the Patient-Focused Public Involvement Coordinator, to talk about how investing in volunteers had benefited its work with volunteers.
I think some of the benefits for the hospital was the realisation of what it is that the volunteers actually do and how they contribute to the organisation. Our volunteers are a group of really altruistic people who really want to make a difference for a group of people who they see as disadvantaged and really quite vulnerable. So I think the organisation has had a bit of a wake-up call in relation to what it is that they do and how much they want to support and assist us. It's quite a challenge to attract people to volunteer with our group of patients, and we need to value and the people that do value and support them so that they can continue to do that, because they make a real difference to our patients. Some of our patients wouldn't have any visitors at all if it wasn't for volunteers, so they would have absolutely no contact with anybody who wasn't a paid member of staff if it wasn't for our volunteers. And they value that, being able to talk about things that are outside our fence.
It's encouraging to hear people speak so positively about the progress of the Refresh strategy from a number of different perspectives. People have talked about improved consistency, the importance of partnerships, a commitment from ministers down, useful policy work, the benefits of investing in volunteers, and the need for volunteering to be mainstreamed by linking to existing NHS work such as patient-focused public involvement and the knowledge skills framework. As Heather Tierney-Moore said, this is just the start. For the Refresh strategy to continue to make a positive difference, we all need to see it as something in which we have a part to play, and something which, if it works, will bring benefits to all of the people living in Scotland.